Nausea and motion sickness can strike at the worst times, whether you're traveling, expecting a baby, or recovering from treatment. What if there was a simple, natural way to ease those uncomfortable symptoms? That's where acupressure comes in. By targeting key pressure points in your wrist, acupressure may help reduce nausea, vomiting, and dizziness. And the best part? With C-bands, you can experience the benefits of acupressure anytime, anywhere, hands-free. In this video, we'll show you exactly how to wear and adjust your C-bands for maximum relief, and how to combine them with other safe, natural remedies so you can feel better quickly and confidently. Let's get started. Putting on and adjusting your C-band. Put on your C-band before travel or nausea begins, as it's designed to prevent nausea. While it can help after symptoms start, it's most effective when worn in advance. Find your Naquan pressure point by placing 3 fingers across your wrist and pressing below your index finger between the 2 tendons. Applying pressure here can help prevent or relieve nausea. Place the C-band button over your Naquan point, facing down. Strap it on, and if nausea persists, adjust slightly until you find the right spot. Wear a C-band on both wrists for best relief. If you have only one, press the Naquan point on your other wrist with your fingers. Using a C-band in relevant situations. Wear C-bands while traveling by car, train, boat, or plane to help prevent motion sickness. These wristbands work by applying pressure to reduce nausea, dizziness, and vomiting, and were originally created to treat seasickness. Use a C-band on vacation to ease nausea from jet lag, unfamiliar transport, or stress. Wear it before traveling to prevent symptoms like fatigue, clammy palms, or headaches. Wear a C-band to help prevent morning sickness, especially nausea and vomiting. Track when you usually feel sick and wear it then. One small study found over 60% relief in pregnant women, though evidence is limited. Use a C-band after surgery or chemotherapy to help manage nausea. Although studies show mixed results, many patients find it gives them a sense of control and relief without interfering with medications. You can wear it either before or after treatment, depending on your preference. Try using C-bands when dealing with nausea from a stomach bug or food poisoning. The World Health Organization supports acupressure for easing nausea and vomiting, and C-bands can be a helpful addition alongside other remedies or treatments recommended by your doctor. And using natural treatments alongside C-bands. Eat or drink ginger to help soothe an upset stomach. Fresh ginger is most effective, but ginger tea, candies, or even ginger ale can also reduce nausea and provide relief if you can't eat it raw. Try peppermint oil or tea to relieve nausea and stomach discomfort. The scent of peppermint oil can help prevent nausea and vomiting, while drinking peppermint tea may also soothe indigestion and calm an upset stomach. Stay hydrated with clear, nutrient-rich fluids like water, tea, juice, or sports drinks. After vomiting, sip slowly to avoid straining your stomach, and avoid heavy, dairy-based drinks, which can make nausea worse. Use home remedies alongside medical care for best results. See a doctor if vomiting lasts over 2 days, recurs for a month, or causes weight loss. Seek emergency help if symptoms include chest pain, severe cramps, vision issues, bleeding, confusion, fecal odor and vomit, or high fever. Thanks for watching.